hypersensitivity. And in immediate hypersensitivity, we have a rapid response to an antigen. And in this type of hypersensitivity, we have the production of IgE. And the examples are diverse, and some famous ones are allergies, asthma, okay? And in type 2, we have antibody-mediated hypersensitivity.
Well, then, is the first type causing the fever of in children?
Sorry?
It causes children fever.
Which fever?
In children, kids.
High fever, you mean?
Yeah.
Yes, high fever is a type of, immune reaction, for example.
For first hypersensitivity.
Yes. High fever is allergy, yes. And type 2 is antibody mediated. Type 3 is antigen antibody complex, yes? What is the difference between these two types? In type 2,
IgM allergy?
no. In type 2, we have antigen on the surface of the cell, in its main site. It is not circulating, okay? So, the antibody goes to the place and attaches to the antigen on the surface of the cell. But in type 3, we have antigen-antibody complex in the circulation, okay? So, by, presence of this complex in the circulation, at some point it starts to deposit in vessels, in joints, and cause the disease. And type 4 is different from the above types because it is cell mediated. And these were humoral. Yes, we had antibody, but this is cell mediated, and we have both, activation of T helper cells and release of cytokines and inflammation, and we have also, CD8 positive cytotoxicity. Okay, we are going to talk about these types of hypersensitivity reactions. As I told you, the immediate or type 1 hypersensitivity is rapid.
Yeah.
Yes, and it happens within minutes. Why is it rapid? Is it always rapid or? We have an allergen, yes, an antigen that causes this reaction is called an allergen. We have entrance of this allergen into the body. Dendritic cells, process these antigens and present them to T cells. We have here in type 1 hypersensitivity, we have activation of T helper 2, yes, because we have IgE. We have activation of T helper 2, and we have production of interleukin 5, which activates eosinophils, and we also have activation of, production of interleukin 4 or 13, and production of IgE by plasma cells, yes? So, for the first time, it may take, longer for the cells to produce IgE and show the reaction, yes? But here we have IgE, which is attached to the mast cell, yes? And, the antigen attaches the IgE and the mast cells show the granulation, and we have release of cytokines which cause tissue edema and bronchospasm and other symptoms. We are going to talk about them. So For the first line, we have, that IgE class switching and production of IgE. But for the next exposures, we have, the IgE ready. Okay, we have the IgE that is bound to the mast cells. So immediately after antigen enters the body, it attaches the IgE and the mast cells, they granulate. So we have a rapid reaction. Okay, that's why it is very rapid. Okay. And I told you the cells that are important in type 1 hypersensitivity are which type of T cells?
T helper 2.
2 and
IgE.
Ig is important antibody, and which other cells?
Mast cell.
Mast cells, eosinophils, these are all important. And we have different types of type 1 hypersensitivity. Sometimes the reaction is local. For example, you have seen patients with seasonal rhinitis. Yes, in, for example, some seasons, for example, some of them, for example, in autumn or other seasons, it depends. They start to have symptoms of rhinitis, rhinuria, and the pruritus and things like that. So sometimes it is local, and sometimes, for example, for example, rhinitis or atopic dermatitis. Most of the times the symptoms are mild, but sometimes they are very severe. For example, in asthma, okay, and sometimes they can be fatal. Have you ever seen, for example, patients who, after eating a special kind of food, they have, for example, they have dyspnea, difficulty breathing, and a shock state, they faint. This is called anaphylaxis. And if it is not treated for example, with epinephrine or proton, they may die because of a shock. So we have different types of this kind of hypersensitivity. They can have mild symptoms or they can be fatal. And I told you about this picture. Can anybody explain this picture for me, just to review? Rusty. No? Why not? Everything is here. I told you that we have, the allergen, the dendritic cells, present this, some part of the allergen to the T cells. We have T helper 2 cells which are activated, and they activate the B cells and class switching occurs. We have IgE production. This IgE attaches the mast cells, and after the repeated exposure to the allergen, we have activation of mast cells, and they have granules that are secreted from them, and we have some symptoms. And some of the mediators are vasoactive amines or lipid mediators. Can you tell me which vasoactive amines you're familiar with? You had it in inflammation, a famous one that causes dilation of vessels and inflammation, histamine, yes?
Prostaglandin? Saccharin?
Serotonin.
Serotonin.
Histamine, serotonin, yes.
Prostaglandin.
Yes, exactly. Metabolites of arachidonic acid pathway, some of them are among the important mediators of mast cells. And by releasing these these kinds of metabolites that are already inside the granules of mast cells, and they are released. Okay, we have an immediate hypersensitivity reactions minutes after exposure. But we also have release of cytokines, and so we have a late phase reaction 2 to 24 hours after the exposure. Okay, so the immediate reaction by mediators, the late phase reaction by cytokines, and I told you we have T helper 2 activation, we have interleukin 4 production by B cells, which causes class switching to IgE. Interleukin 5 activates the eosinophils, and interleukin 13 is important because it stimulates the secretion of mucin. Okay, and after that, as I told you, IgE binds mast cells, and we have activation of mast cells and release of mediators. Okay, about mast cell mediators, I told you that some of them are ready. For example, histamine. What are the drugs of histamine? You may recall it from inflammation. For example, dilation of vessels, for example, increased permeability of vessels. So, in type 1 hypersensitivity, we have vasodilation, congestion of vessels, and we have edema. Yeah? And we also have some other mediators in mast cells, for example, some chemotactic factors, proteases, and other mediators. And we had them in the grams. Okay? So the mast cell does not have to make them at that time. They are ready. But there are some of them which are not ready, and the mast cell makes them. Okay? These are what metabolites of arachidonic acid cascade. For example, vitamin D2, which is the most abundant, leukotriene C4 and D4, which is the most potent, and vitamin D4. And also production of cytokines, for example, TNF, chemokines, interleukin 4 and interleukin 5. So, you know what atopy is.
Decrease in size? No.
Two old people showed the same reaction against allergens.
Increase in hypersensitivity and so increase in interleukin 4. That will lead to increase in human-like receptor and cytokine.
Atopy is, a genetically determined susceptibility to allergy. We have met some people which are allergic to, for example, you may be allergic to pollen, but are not allergic. Yes? Because some people have, some certain genes that makes them allergic to different allergens. Okay? So, this is called atopy. So, what is atopy?
Increase in hypersensitivity.
Increased, yes. It is genetically determined, and it causes hypersensitivity to certain antigens, which are called allergens. Yes. And so, genetic is important in allergy. Environment is also important. Yeah, for example, some people have allergy to food, so they should not consume those kinds of foods. Okay?
Is that related to IgE?
IgE?
Yeah.
Allergy is related to IgE.
Atopy?
Yeah. Atopy, is susceptibility to allergens.
Oh, I see.
Some people are atopic. Okay, you will learn it in pediatrics mostly. Some people are atopic. They show allergy to a lot of different kinds of, for example, allergens. And it is said that people that have not had exposure to infections in their early years of life are more susceptible to allergies. And this is called hygiene hypothesis. Their body has not had exposure to infections, and after, for example, they become older, they are more susceptible to allergens. Okay. Okay, I told you that we have different kinds of reaction to allergens. Immediate reaction and late
Late
phase
phase
reaction.
reaction.
What do you see in this picture? Is it immediate or late phase?
Late phase
What
because of edema.
do you think? No, edema is early.
Oh, right.
I told you that early I have mast cells. Yes, and here I have mast cells, and I have edema and vascular congestion. So it is early. How about this one? I have eosinophils.
Late.
Late because for eosinophils I should have activation of cytokines, and that happens late. Okay? So here we have mast cells, so it is early. Okay. In this table, you see examples of immediate hypersensitivity disorders. For example, anaphylaxis, as I told you, bronchial asthma, allergic rhinitis, eye fever, as I already said, and food allergies are among the type 1 hypersensitivity reactions. Now about type 2 hypersensitivity reactions. Do you know any diseases that are related to type 2 hypersensitivity reactions? Purpura, yes, ITP, for example, purpura. That's because of the action of antibodies against antigens on the surface of platelets. Or, for example, hemolytic anemia. Yes. So, in type 2 hypersensitivity, we have antibodies against antigens on the surface of cells. For example, these antigens may be intrinsic or extrinsic. Intrinsic, for example, like thrombocytopenia, which is immune. The antigen is on the surface of platelet, so it is intrinsic in our body. And sometimes it is exogenous. For example, drugs. The cell metabolizes the drug, and a part of that drug is on the surface of the cell as an antigen. Okay. We have different types of disorders caused by type 2 hypersensitivity. For example, we have autoimmune anemia or thrombocytopenia and purpura. We have pemphigus vulgaris. We have oncotype vasculitis. We have good posture syndrome, acute rheumatic fever, and also, sometimes we have, destruction of the cells by this immune response. Okay, like all these disorders. Sometimes we have dysfunction of the cells by the antibodies, such as myasthenia gravis and Graves' disease. Okay? So it is not always destruction of the cells. Sometimes it causes dysfunction. The antibody causes dysfunction of the cells. Okay, so sometimes we have phagocytosis, and sometimes we have complement system activation, and sometimes we have interference with function. Okay? example here, can you explain this picture for me? Let's see. Come here and explain this.
The activation of opsinians because the involvement of microbe inside the phagocyte, and this involvement causes release of some lysosomal enzyme destroyed, right?
Yes. So the main thing is that we have antibody, okay? It attaches the antigen, and after that it induces phagocytosis by opsonization. Yes? Okay?
Is not that related to this receptor? Adam and 12 and
Yes, 13. Yes, is important. The antias is important in, hemolytic uremic syndrome and some immune hemolytic anemias. Yes.
So it's related to phagocytosis?
Yes. And okay, so we have phagocytosis. And some examples of type 2, immune reaction or transfusion reactions in which we have, for example, the wrong type of blood group given to a patient, and there are RBCs with antigens that our body reacts against by antibodies, and we have destruction of these RBCs, and we have transfusion hemolytic reaction. And also we have hemolytic disease of the newborn, autoimmune hemolytic anemia, agranulocytosis, thrombocytopenia, and some drug reactions, as I told you, may cause this type of reactions, against, for example, RBCs or other types of cells. Okay. And sometimes, as I told you, we have activation of complement system. And for example, in organ grafts and some, for example, glomerulonephritis, we have this type of antibody-mediated inflammation by lack of complements. You will have it in, the graft part in the next sessions. Okay. So in rejection of grafts, we have one of the types of rejection is this type of inflammation, activation of complements by antibodies.
Now the third type of hypersensitivity?
We have second, and we can also sometimes have third. Okay. But second part is second type is also important. Okay. And about the third type, what is the difference between second and third? I told you. In the third type, we have antigen, antibody complexes. Okay, what happens to these complexes?
They accumulate in the joint and cause arthritis.
They are deposited, yes? And this deposition activates the, some kind of inflammation. And again, in this type, the antigens may be exogenous, for example, microbes, and sometimes there are endogenous, for example, self-antigens, like what we have in lupus, for example, systemic lupus erythematosus. Okay?
But then how's that related to, like in arthritis, there is increase in lipid in the joint that causes the joint to be eaten. So how that's related to hypersensitivity?
In what?
Arthritis causes increase in lipid in the joint. acid. No, increase in lipid will cause increase in acid in the joint, and this increase in acid will cause arthritis. So how is that related to hypersensitivity?
In which lipid in the joint? By which disease?
Arthritis.
Atherosclerosis?
Joint disease.
No, arthritis.
Yeah.
Okay, arthritis has different causes. One cause is the position of immune complex. It may have other causes. For example, the position of lipid. You mean sometimes it occurs.
No, increased consumption of the lipid will increase the amount of the acid that being released in the joint. Right?
But it is not a type of type 3 hypersensitivity. This is not type 3.
So for people who have arthritis, what should I tell them?
We have different types of arthritis. We have infectious arthritis. We have, for example, immune-mediated arthritis. This is only a type of arthritis. Okay?
I see.
And the immune complexes, are eager to deposit in some certain parts of the body, the vessels, the joints, and the kidneys. Somewhere in which filtration occurs, filtration of fluid, for example, in kidneys and joints, and in vessels because they are circulating in the body.
So I have to tell them that you have to become a vegan?
No. I don't know which type of arthritis you mean. In gut, you mean?
No, there, joint.
No. Which type? Caused by which disease?
Diabetic.
Oh, diabetes. Diabetes, joint disease, occurs, at advanced stages of the disease, and I think, as I know, the most important part of, treatment is not treatment because if it has caused, destruction, you can do nothing. But in order to prevent more destruction, you should lower the rate of, lower the blood sugar level. Decrease blood sugar level will help.
So I have to tell them to eat less?
No, in diabetes patient, the diet doesn't work anymore. They should take insulin or drugs.
I see.
For herediabetes, the diet may be helpful. The change in diet may be helpful. But in diabetes, they should take medications. Yes. Do you have any questions? No?
Just
I thought you were raising hands. Okay. So in type 3, we have the immune complex mediated diseases. And we have different types of these diseases. For example, one of the important ones is systemic lupus erythematosus. We also have PSGN, PN, and reactive arthritis. We have serum sickness and arthritis reaction, which I want to talk about. And next session we will talk about lupus. Lupus is mainly caused by type 3, but also by type 2 sometimes. Okay, what do you see in this picture? What is this? A vessel. Yes, you have the basement membrane here. You have endothelial cells here. Yes. Okay. And here you have, production of antibody which attaches antigen in circulation. And you have the complex. And the complex activates, inflammation. Yes, so you have inflammation, activation of neutrophils, complement system, and after that, tissue injury. Okay, sometimes this immune complex disease is systemic. Most of the times it is systemic. But how can it be local? Why is it systemic?
It activates your immune system.
In the circulation, yes. So it can, deposit in any part of the body, yes. For example, in joints, in vessels, other parts of the body. So it is almost always systemic. For example, you may have heard about serum sickness. Sometimes, for example, in patients with diphtheria, they took serum from immunized horses, in order to, some antibodies in the serum fight the antigens of diphtheria. So they took serum from immunized horses. And, after administration of large amounts of this serum, they showed acute serum sickness. Okay, why does this happen? Because of in the serum of horse we have antigens, and because it is taken from an animal we have antigens, and we will have antibodies against them, and we will have immune complex deposition. And when we have this immune complex deposition, we have inflammation, and after that we have tissue injury. And in the patients, for example, with lupus, we measure the amount of C3 complement factor. Okay, because of the consumption of C3, because of the activation of complement system, we have reduced level of C3 in their blood. Okay.
Reduce.
Sorry.
Reduce, but in hypersensitivity 3 increase, right?
Sorry.
If increase in IgE, that mean what?
Oh, IgE.
Yeah.
Yes, that's the same. For example, in patients with urticaria, or for example allergies to food, etc., we measure the amount of IgE in blood.
And it increase.
And it is increased.
But there it's reduce. But in this case it's reduce.
Reduce.
In lupus reduce.
Mostly the complement factors are reduced because this type of hypersensitivity has nothing to do with IgE.
I see.
We can say that, for example, IgG, IgM, but the thing, the factor that is measured in order to follow the patient is C3. Okay. In this type of immune reaction, we have necrosis of vessels because of the position of immune complexes. What is the type of necrosis that we have in vessels? You should recall it.
Fibrinoid necrosis?
Fibrinoid.
Yes.
Yeah. Fibrinoid necrosis is the type of necrosis that we have in vessels. Okay, here you see the deposition of fibrinoid material in the vessel wall. And this is immunofluorescence study of kidney. And here you see deposition of, granular deposition of immune complexes in the kidney. And I told you, most of the times we have systemic symptoms due to immune complex deposition. Yes, but sometimes we can have local form of immune complex disease, which is called Arthus reactions. How is it possible? We induce this type of reaction. For example, we inject a special kind of antigen against which the patient has antibody. So we inject this antigen, there is antibody, the complex is reduced, and we have deposition of complex in the vessels locally at the site of injection. Okay? Did you understand?
We lost.
Hmm?
We lost.
Oh no.
Too much information.
Oh, too much information. You wanna rest?
Yes.
Okay. Tell me. 10 minutes rest.